Hello everyone. In this video, we are going to introduce a new category of the internal organs, the 6 Fu organs. So in previous videos, we have introduced the internal organs in the Zang Xiang theories. We divided the internal organs into the 5 Zang organs, the 6 Fu organs, extraordinary organs. So we divided all the internal organs into these 3 different categories. And the reason why we divide them, that's because of their characteristics are different. So this we have introduced in the general introduction of the Zang Xiang theories. The Fu organs are hollowed inside, and then they receive and transport. They will never store. So these organs should not store any kind of stuff. They can receive, they can transport, but they should not store. So this is different from the Zang organs. Zang organs, they should store essence and qi. The 6 Fu organs refers to the gallbladder, the stomach, large intestine, small intestine, sanjiao, and urinary bladder. So as you can see from here, it's actually mainly refers to the digestive system and sanjiao. Later we're going to introduce what's sanjiao. But apart from sanjiao, the other organs you already know from your anatomy. And as you can see from the previous studies on the Zang organs, although we introduced the anatomy, where the organs are, but we actually do not focus on the anatomy. So that's why it is quite different from your anatomy study. We introduce that the organs and where they are, but we don't really care about what the tissues of each organs. So that's the study in your anatomy. But in Chinese medicine and acupuncture theories, especially the Zang Xiang theories or Zang Fu theories, we more focus on the function. In Nanjing, that's the second classic. It described that our digestive system, because 7 gates. In Nanjing, it is described as the chong gate, the 7 chong gates. So the first one is the fei gate, the second is the hu gate, the third is the xi gate, the fourth ben gate, the yu gate, sixth line gate, the eighth po gate. So when we introduce these 7 gates, as you can see, that's from the early anatomy. The fei gate refers to the lips. The hu gate refers to the teeth. The xi gate refers to epiglottis, and ben gate refers to the joint between the esophagus and stomach. Yu gate, the joint between the stomach and small intestine. So that's the lips, the teeth, fei gates, and one here. Yu gates, the joints between the stomach and small intestine. Line gates is around here, the joint between the large intestine and small intestine. Po gates is the anus. So as you can see, actually these different gates from Nanjing, from the early anatomy, actually our ancestors or the the early practitioners at that time already knew the differences in our digestive system. So the whole system, they are not the same. They got different functions in different area. That's why they use different gates to indicate small intestine and large intestine. So these anatomy are actually quite similar to our modern knowledge or our modern understanding towards our digestive system. There are different gates there. The common characteristics of the 6 food organs is to receive and transport food without storing. So they should not store food. If they store, it will cause the pathological changes. So the first organ we are going to introduce is gallbladder. The gallbladder is located under the liver. The meridian connects to the liver. So as you can see, that the liver, when we introduce in Zang organs, the liver connects to the gallbladder, and now the gallbladder, the meridian, also connects to the liver. That's why we consider these two as the coupled meridian, because they also actually link to each other. The function of the gallbladder is storing and excreting the bile. That's one of the main functions of the gallbladder. In Chinese medicine theories, where does the bile come from? So it's very similar. The question, where does the blood come from, or where does the qi come from? Now the question here, where does the bile come from? The bile, in our theories, we think that the bile is the extra qi from the liver. So if the liver have extra qi, and then it will store in the gallbladder and then become the bile and store in the gallbladder. So the formation of the bile relies on the liver qi. So in this case, the liver qi and the gallbladder are closely related together, and the excreting of the gallbladder of the bile, that's a kind of movement that's very similar to the other movements of qi and blood. So the bile, when the bile needs to move, you also rely on the liver qi, because the liver governs the flow of qi, of all the qi, or we call it the qi regulation. The excreting of the bile also a kind of a qi movement. So if the gallbladder, the dysfunction of the liver and gallbladder, it will cause the disorder of storing and excreting of the bile. This will cause pathological changes such as jaundice if the bile, the storage and excreting cause problems, or in a more mild case, the patient may suffer from poor appetite or distenting food or diarrhea, which is also the function of the bile. The bile can assist the food digestion. This is also this understanding is actually very close to the modern science. And when the liver qi move upwards, the gallbladder qi move downwards to excrete. If the gallbladder qi move upwards, which is the pathological changes, then patient will feel better taste in the mouth or vomiting with like green color mucus. That's the function for storing and excreting the bile. The second function dominating the decisions. This function actually quite confused. This refers to that's our because making a decision is actually a psychological activities or mental activities, but this activities is determined by the gallbladder. So in this condition, if someone have the dominating function, the making decision function disorder, what happens if what we can see from the environment or we from the phenomenon, it's actually the patient. You can see those persons or those people. They are very hard to make decisions. So the examples, there's one students, very talented students, and then during her study, she asked the teacher that she says there were two handsome gentlemen showing love to her, but she feels that both of the gentlemen are very good, and then she can't make a decision to choose which one to be her boyfriend. And then after a few years, she still could not decide. So, and then eventually she graduated. And after she graduated, she sent applications to different companies, and she also received several offers. But when she saw the offers, again, she could not make decisions because each offers have some pros and cons. So she could not decide which one. And this person is actually the actual person in our reality. And then in her whole life, wherever she has to make choices, it's very difficult for her to decide which one to choose. In this situation, this kind of psychological or mental activities in Chinese medicine, how can we analyze this kind of phenomenon? This kind of phenomenon we refer back to the gallbladder. So in this situation, we think that this kind of person, their gallbladder function is weak. That's why they can't make decisions. And then how can we help them in this condition? We're going to use the different treatments to enhance the function of gallbladder, which can benefit the psychological and mental activities. And also, if someone with the weakness of gallbladder symptoms, weakness of gallbladder function, this kind of person also easier to be scared. That's another sign of the weakness of gallbladder. So this kind of psychological and mental activities we will refer to gallbladder, and then that's how we use the internal organs to analyze the mental and psychological activities. So as you can see, from the Zang organs until now, we have introduced quite a few organs, and then as we introduce the different organs, we use different examples, and then all these examples, all these clinical phenomena will be referred back to the Zang or Fu organs. Also, when we talk about the gallbladder, we also relate to liver. You see that the psychological problem, the mental problem. Actually a kind of feeling, such as scare or fear. That's emotion. Emotion, when you go back to the Zang organs, you also link to the liver. That's why the gallbladder and liver, they always link together. So that's how we use the function to analyze the phenomena. And the gallbladder also considered as the extraordinary organs. The extraordinary organs is different from the Zang and Fu organs. A gallbladder considered as Fu organs and extraordinary organs. This is the only organ that's considered as both. The reason why gallbladder is considered as both is because the gallbladder is hollowed inside, which is similar to the Fu organs. They're hollowed inside, but when you see the gallbladder stores the bile. But when you see the bile, it's similar, a liquid form that's be considered as essence. So the previous practitioners at the very early time, they think that the gallbladder have a similar function of storing essence, same as the Zang organs. That's why gallbladder is considered as extraordinary organs as well, because it is hollowed inside, but it stores essence, the similar function to store essence. That's why it's considered as the extraordinary organs. But the gallbladder also hollowed inside, it receive the bile from the actual liver qi. So the actual liver qi transform into bile and store in the gallbladder. But the gallbladder also excreting the biles. So this function is very similar to the Fu function. They receive something, but they transport to other area. So the gallbladder receive the liver qi, which were transformed into bile and then excretes to other area. So this function is similar to Fu organs. That's why we consider the gallbladder as Fu organs and extraordinary organs. This is the only organ have these two belongs to two categories. The second organs we're going to talk about is the stomach. The stomach is situated beneath the diaphragm. The meridian, the stomach connects to the spleen. So the spleen and stomach are coupled meridian. The main function of the stomach is receiving and decomposing the food and water. It dominates descending. So the first function, receiving and decomposing food and water, this function actually is the combination of the spleen. You still remember that when we discussed the spleen function, the spleen receives transport and transportation and transformation of food and body fluid. This function, but whenever we talk about spleen, I always combine with spleen and stomach. That's because these are coupled meridian, and then the function of receiving food and water is actually reflects in the stomach. The food from our mouth go to the esophagus and go to the stomach, and the stomach receive all these foods and transforms the foods into qi. The spleen can help this kind of qi to disperse into the lung. That's how we introduce the Zang organs. But as you can see here, the food from the mouth through the esophagus and the food stored in the stomach. So actually, the stomach has another name. We consider the stomach as the sea of the grain and water. So the grains and water are actually referred to the food. So we said the stomach is the sea of the grains and water. Also, because of the stomach stores, receives the food and water, we also call the stomach as the storeroom or storage. These food from your mouth goes to the stomach, and stomach as under the function of the stomach and spleen. This food, some of the food, transformed into the qi and blood, and the other food and water will be transported through or will be descended to the intestine. That's from the function of dominate, descending. That's from the function of descending. And because of these qi from stomach will be transformed into qi and blood. So we also call stomach is the sea of grains, water, qi, and blood. So you see how many different names here for stomach. The storage or the storeroom, the sea of grains and water, the sea of the grains, water, qi, and blood. These different names all refers to the stomach, and that's exactly because this kind of function, receiving and decomposing food and water, is very important for the acquired qi and stomach, and acquired qi and blood. And this kinds of function actually reflects in all kinds of our daily life, and the treatment. So in treatment, in diseases, when we see patients, how severe the condition is or the prognosis, is it good or not? How can we know? We see from the stomach, we see from appetite. If the patient suffers from very severe condition, but the patient still can eat, the digestive function still good, then we think that the patient still safer, we can't say safe, but safer condition. For instance, now we saw one lady at the age of 69, she received the chemotherapy, but in the meantime we use Chinese herbal medicine to assist. But what we assist, or how can we say that her body condition is good or not? During the consultation, I will always ask, that's how do you want to eat? How about your appetite? So we focus on the appetite. Your eating is not only from your eating, it's actually we want to know your digestive system, your spleen function, and your stomach function, which can refer to the stomach qi. So the stomach qi is very important in our treatment. Or if some very mild condition, very mild clinical condition, and then you feel that this ailment is not too severe, so you don't care about that, but in the meantime, you realize that the patient have no appetite. The patient does not want to eat. So this reflects that the patient's 胃气 is weak. And in this case, you need to be careful that this case might happen, may change into severe case suddenly. So that's because of the function of the stomach as receiving and decomposing food and water, where our nutrition come from. That's the acquired qi and blood come from. And also this kind of function also can reflect in our daily lifestyle. As you can see that like now whenever we greet each other, we say hello or good morning. But if you have chance to study some of the Chinese culture, Chinese habits, then you will realize that the Chinese, when they greet each other, they don't ask you how are you or good morning, good afternoon. But what we ask in the morning when you meet your friends, we ask, have you eaten? In the morning, in the afternoon, when we meet your friends, we ask, have you eaten? In the evening, we also ask, have you eaten? So as you can see, if you don't know the culture or you don't know the reason behind this, you will feel funny. Why you always ask me, have I eaten? Does it matter? The answer is yes, it does matter. But what matters there is we actually do not care about have you eaten or not. But actually, this reflects that we care about your health. From your appetite, from these simple questions, we want to understand that your health. If you eat well, then we think that your stomach qi is very well. So your health is in good condition. If you don't eat well, then we realize that your stomach qi is not that well. So in this condition, we actually concerned about your health instead of only the eating. There also another story of the three kingdom in the past. The three kingdom period is also more than 2,000 years ago. That's the historic period in China. The three kingdom, the three kings in China in the continent. They fight each other. But they could not win each other. So they are kind of balanced. And then there's one day that one person as a prisoner was took to the other states. The king in the other state asked the guy from the other country. He asked, "That's how is your prime minister?" That prime minister, he was very famous in China. Zhuge Liang. So his surname is Zhuge. His name is Liang. He was one of the most famous historic figures in Chinese history. And then the other king in other country, the king in other states, concerned about this prime minister in the other states. And then the king asked the person, "How was your prime minister?" And then the person answered that our prime minister worked very hard and he didn't eat a lot. All matters, all events in the states, he need to go over. He worked very hard for there. And then when the king from the other states heard about this information, he felt very happy. The reason why, only from this conversation, the person from the other state and the king asked the person, "How was your minister, primary minister?" And the conversation, the person answers, "That's our Prime Minister worked very hard and he didn't eat a lot. Only from this conversation, the king realized that the health of the Prime Minister is not very good. That's why he felt happy that because that Prime Minister, the health is not in good condition, and he will pass away in a very short period. And then, from the historic records, that's the truth. The Prime Minister of that state passed away in very short time, and then the other states win and unite the whole country. But from this story, you see, from those conversations, from the stomach, from your appetite, we actually focus on your health. But why from the appetite, from the stomach qi can reflect your health? That's because of the function of the stomach, of receiving and decomposing food and water, which is the source of acquired qi, where the acquired qi come from. That's from these two, the function of stomach. So if a person have no acquired qi and blood, then that person will have no nutrition, which means their health should not be in good condition. The second function of the stomach is dominates the descending. This dominates descending. By the way, the receiving and decomposing are two aspects. One is to receive and store. Decomposing is to transform the food into qi and blood. Okay, so the second function, the dominating descending. This is compared with the spleen. The spleen governs the rise. The stomach dominates descending. So these are also yin and yang. One is moving up, one is moving down. Then that these two functions also need to be balanced. The descending reflects in the food and water, especially the food. The foods we decompose from the stomach, and then the rest of them will be descended into the intestines, and then to the large intestines, become the waste. And also the body fluids also will be descended into the kidney and the bladder. So because of this function of the stomach, if the patient lose the function of descending, what will happen is that if the food stored in the stomach and is supposed to descend into the intestine, but it reverses to the mouth, which causes nausea, vomiting, or hiccups. Or if the descending function is affected by the others, which means the stomach lost the descending function, the patient also may suffer from constipation, stomach ache. That's because of the food in the digestive system, in the stomach, in the intestines, did not descend. That's from the descending function. So that's why for the treatment of stomach, with most of the condition, we will recover the descending function. We will help the stomach to descend, such as for vomiting, for nausea. How can we treat them? We will recover the spleen, the stomach function, and then the stomach can function back, can gain the function of descending again, and then the vomiting can be healed or can be alleviated. So these are the two main functions of the stomach. There's also one characteristic of stomach. The stomach prefers moisture and dislikes dryness. When you see these statements, do you ring any bells in your brain? That's when we discuss the spleen, we said that the spleen prefers dryness and dislikes dampness. So this is exactly opposite. The stomach prefers moisture and dislikes dryness. So this is actually also a balance between the spleen and stomach. The dryness and the dampness, the moisture, also kind of dampness, need to be balanced. If the stomach is dry, then the digestive system, the receiving and decomposing food function, will not perform well. That's why in the treatments, we will improve the body fluids in the stomach in some digestive problems. So because of the stomach have this kind of preference, so in our treatments we need to be careful that if we use something to clear the dampness, then we need to be careful that we should not clear too much. You need to think about the characteristic of stomach. We need to find a balance between the stomach and the spleen. So these are the functions and characteristics of stomach. We will stop here today, and in the next video we're going to introduce the small intestine. By the way, from the introduction you will see that when we introduce the full organs, you can see that we actually introduce much more in Zang organs. That's because of the Zang organs considered as more important in the internal organs. They are dominant. Zang organs. Full organs is like supporting. Although they are also important, but compared with Zang organs, we more focus on Zang organs, and all diseases, all causes will trace back to the Zang organs. Okay. Thank you guys. See you in next video.